Okay, here we are with part 2 of 3. Let's continue on with the story.
Anyway, hello, good morning. I was about to say good morning. I'm like, wait a minute, it's good afternoon. It's going on 1300, after 1300 hours, right?
Yes, it's 10 past 1300.
So it's 1310.
Yes.
So anyway, what I want to get to with this video, this part of the video, this might even
Have to be put into 3 parts.
maybe, I don't want to make these too long. And last night's video ended up being,
It ended up being longer than expected.
I didn't intend it to be that long, but it just ended up being that. So I think we're going to see how we can break this down to make it shorter, easier to digest for all of you viewers. But I got a bunch of paperwork back from that they gave me, and take this one off, or just open up the clip. Yeah. So let's see. So the they actually broke it down phonetically, kind of. Fluorouracil. So it's fluorouracil. I don't know, you're a windowsill or what? Nova Plus Premier Pro RX Fluorouracil. There may be other brand names of this medication, yada yada. There's just a lot of information, and so if I go outside into the sun, I should be wearing sunscreen. Stay covered up if going in the sun. I gotta be mindful of mouth sores.
We'll get you a little parasol.
Like herpes. And I'm not talking about herpes that you have to go get medication. It's called a herpes because it's a mouth sore. So side effects: nausea, diarrhea, and mouth sores. So it's handwritten at the top there. Warnings while using this medication: do not breastfeed. Okay, I don't think I'll be breastfeeding anytime soon. Avoid drinking alcohol. Talk to your doctor before getting vaccines, such as flu. I've never gotten a flu shot, never will. Before you start your treatments, tell your doctor if you have any infections. Basically about bone marrow, liver, kidney. So there's just things that this stuff that already has been discussed, and doctors already know about all of this. When this medicine should not be used. You should not be treated with this medication if you have had any allergic reaction to fluorouracil, whatever. I wouldn't know because I've never had this medication. But anyway, yeah, that's pretty much it for that. Let me see that one there. This one I just put that back under there. And I got a package. We're gonna go over real quick. It's gonna just bear with me here. So all vital information will be blocked out here. So this is from the PET scan that initially I was told they did not have the reading done by my oncologist lady doctor. Let's see, I'm just going over this information here. The patient has a history of esophageal neoplasm and presence of evaluation. I don't know what that means. CT and myocardial studies within the past 12 months. Time scan 1 hour and 3 minutes. There's some numbers here that I guess are for the doctor. This is the PET scan that I went for, and the findings I'm just going to basically skip over. Visualize head and neck normal metabolic activity, chest metastasium normal distribution of metabolic activity, HILA, whatever that means. HILA, I know. Normal metabolic activity, axilla. unremarkable. Unremarkable. That must be like, yeah, baby, that's fantastic. Breasts. See, men have breasts too, but they can't breastfeed unless it's done artificially. No mass or abnormal activity present. So my breasts are clear of any kind of lumps or nodes or whatever they want to call them. Lung, parenchyma, no abnormal metabolic activity. Abnormal pelvis, abdomen, no abnormal metabolic activity within the abdominal vesica or mesentery. See what else? You know what? I'll probably just have my daughter, because we already scanned this into the computer. We're keeping a record of all these documents, and but again, all vital information will be removed. I'm not going to be doxing any doctors or anyone involved in this. I'm just not into that. Not unless the doctors say, yeah, you could use my name and my likeness, but then I would have to get a document signing off on that, because you can get into a lot of trouble doing that. But yeah, so there's nothing unremarkable PET CT, no. Why have to write it twice? Capital no. Abnormal metabolic activity present to suggest residual recurrent tumor. Okay, it's electronically, yes, electronically signed by on 3/9/2025. So that's basically it from the PET scan. I know I kind of breezed through that, and like I said, somewhere in this video that document will be there for you to read. It might scroll. I don't know. We'll figure out how to do it. But for those that may be interested in what this all is, and who have never gone through this, or might be in the beginnings of all of this and what to expect, you'll see my daughter looking at my chemo ball that I'm wearing in my fancy fanny pack. And I mean, it's cheap. Oh my God. I mean, honestly, when I said it in the car coming home, I don't even think you could buy this in a dollar store for $1. That's how cheap this is. This is amazingly cheap. I am really surprised that the hospital would chintz out on something like this when you're dealing with cancer patients. And I'm not the only one, okay? The thing is, this has to stay below the port. According to a nurse, if it's higher than the port, then it's fighting gravity. I don't know what that means, but I would think gravity flows down. You know, everything, you know, whatever goes up must come down. So, I don't understand how that would be fighting gravity, because it's got to pump up now instead of, even if it was on top of my head, you know. See this ball on my top of my head, you know, let gravity feed in with the pump, you know? I don't know, just thinking off the top of my head. Maybe I'm just, you know, cuckoo crazy. I won't be too far off sometimes. But anyway, let's get the box and we'll go through the goodies. Put that aside. Hold on, let me move my Ricciolas. So this is a pack that's used for if there's a spill. I'm not even on camera. There's a pack that's used for cleaning up a spill of this chemo medication, and that's basically to. It's almost like a hazmat type thing. There's all kinds of stuff in here. I'm not going to open it. I'm just going to leave it like that. But it's got a pad in there. Looks like all kinds of swabs. I don't know. It's basically the best thing I could say is like a hazmat cleanup thing. But that's only if there's a leak in the, it's only if there's a leak in the, from the medicine ball to, no, these are just,
Those are just alcohol.
yeah, they gave us a whole box of alcohol prep pads. We could use these, that's for sure. Yeah, you can speak, you know, you have a
Yes, I
voice.
know.
There's more. This is
That's
all,
the same information, that packet there.
yeah. So let's just do it this way. There's a lot here, but no, some of it is, but there's a whole packet here. Okay, I mean, this is a lot to read through, and and basically duplicated information that I already have is scanned in a computer. Now this is the Sharps container that they gave us. As you can see, the hazmat logo, and this is something that the insurance company will pay for with no problem. Let's see what else is in here. You can take that paper. This is for the nurse that will come here. Again, another chemo spill cleanup kit. You got pink gloves, a yellow plastic mat. Yeah, it's another, it's for any spills for cleaning up.
I want to correct you really quick.
What?
This is not a spill cleanup kit. This is a dressing change kit.
Well, that's okay. My mistake. My daughter corrected me. This is a dressing. So if something goes wrong with this up here, and I don't think down here, maybe where the
No, because there's no dressings down there. It's just tape.
yeah, this is just all taped down here. But if this needs to get, for whatever reason, needs to be changed, that's for us to do. This is not for the nurse that's coming. But it's a let's see here. I don't know how well you can read any of this, but it's a dressing change kit. It's basically for us if need be. And
That is the
this
spill
is
kit.
the spill cleanup kit. See the nice pink gloves, and the yellow plastic mat. I can't
Well, not a
believe.
mat. That's it. That's it. Like a has not a hat.
I don't know. It looks like a mat to me right now. I'm not opening it because this is basically for the nurse that will come and discontinue, not disconnect. It's going to discontinue the medicine chemo ball. What is this again? Chemotherapy drug. What is this?
More gloves. The what?
More gloves. This is
Therapy drugs.
after use, dispose of according to the fabric. Let's see. Observe safety precautions for handling and administration. Transport bag. Okay.
Oh, that's probably what they'll put it into.
Yeah. This again. The hazmat logo. And the reason why I say it that way, that the insurance company will pay for this with no problem. No problem. They're like, you want? Oh, sure. How much do you want? No problem. Just give them a couple of tons. Don't worry about it. We'll pay for it. There's a medication that they were looking for. What was it called again? It was about some kind of like an antibiotic or something like that. You remember? She was the doctor was saying that when we were talking to her.
I don't remember that.
There's one particular, it's supposed to help the healing process that the chemo does, that because chemo does damage to the body. And
It's not radioactive, but it's.
no, it's not radioactive, but it does do damage to the body. And there was one particular medication, one kind of therapy that they want me to do, but the insurance company, or I'm so used to calling it another name, just a little, which I got from a doctor, mind you. The company is called Evicor or Ebicor or something. One doctor called it Evil Core because I've dealt with them multiple times. I can't tell you. I got maybe a dozen of their letters. And I might be exaggerating a little bit, but they, because initially this all started with a pain in my right side, and that could have been caused by the Manjaro, which can cause pancreatitis, which I found out while I'm going to multiple doctors to get clearances to get this operation done to put the port in. And my primary care physician cannot access this port for drawing blood. It's a special type of needle. It's a process they have to go through to prep the area before they can even begin to draw blood. But so they are the intermediary. So you go to your doctor. Let's say you go to Dr. Abe, and patient Charlie is requested to have a scan, and your insurance company is Acme Insurance Company. My daughter hates it when I go down the Acme Road.
Acme a lot, yeah.
Yeah. Anyway, but there is an Acme shopping store, which is still thriving. But anyway, you go to your Dr. Abe, Dr. What did I say, Charlie?
Patient Charlie.
Patient Charlie.
Chemo brain.
Yeah, chemo brain. Somebody has chemo brain. Not me, not yet. At least I don't think. So you, patient Charlie, go to Dr. Abe. Dr. Abe tells insurance company, they send in the referral, the request to have a CT scan. And I had to have one with barium. Anyway, and Acme Insurance Company has to, before they get it, they go to a company that's actually called Ebicor, and I forgot which doctor I went to, but they called it Evil Core. Because by the time I got the approval to get the CT scan with the barium liquid, I had to drink 2 16-ounce jars of this stuff. I think it was almost a month, maybe more. But I had to go get x-rays. I had to go get ultrasound of my abdomen area, part of my abdomen, and my side, mainly by the liver, kidney areas, and which also imaged the gallbladder, and that's where they told me that I have gallstones. They're non-active, whatever that means. I'm not feeling any pain from that, but as I've been going through this, and then I had to go get releases from multiple doctors, and when I went to my sugar doctor, or anti-sugar doctor, that's when I was told, when I was getting the clearance from her, that Manjaro, while it's great in helping you control your diabetes, can also cause pancreatitis. Had to do some readjusting with the camera and the blue screen, which you will not see. So, but it does matter in post editing. So anyway, there's a therapy that I need to. It's like an immune therapy of some sort, and it's supposed to help with the chemotherapy. Okay, and they're not. They're having a hard time getting approval because of.
It's this.
Okay. It's this.
Yeah.
Where?
Because it's if you look at the top, it's written that it helps your body.
Vitamin supplement helps your body respond to 5-FU.
Yes, that's the medicine. 5-FU in your little bubble.
Okay, so I could just call it 5-FU. That's not a joke.
It's not.
It's not a joke. Hey, look. 5-FU. Okay, so don't take folic acid supplements. No, I don't do that anyway. But anyway, Calcium Nova Plus, Primo Pro. Okay, I already read all that. Anyway, I don't know if that's the same thing. But anyway, the doctor's having a hard time getting approval for this this treatment that they want me to do, and they gotta finagle the wording. They gotta finagle how they write it, and it's really ridiculous because, like I said, they will approve all this. I mean, this stuff can kill you, okay, if not done properly, and it could really damage your body, your kidneys, your liver. I mean, it is amazing. They'll even approve radiation for cancer, okay? Stuff like this will be approved in a flash. You won't even have to. Hello, we need chemo. Yep, okay, bye. Literally, the phone call wouldn't be more than 10 seconds long. But they seem to be doing it in snail mail. I'm getting notifications about denial when it's been denied by the time I get the letter in the snail mail about a week later.
Or how about when you went for the PET scan and literally a week later they told you it was approved?
Well, that's another thing. They wouldn't approve the PET scan, but I went for a CT scan, which they approved because here's the thing. I needed to have an Alvarado score. What is an Alvarado score of 4 or higher? I never heard of Alvarado scoring for the medical industry. I know I'm getting a bit loud here, and I apologize. But it's very annoying when you have to deal with the insurance company and, as one doctor called them, Evil Corps. Their actual name is Evicor, and they are the organization, the in-between, the middleman that approves or denies what treatments, what type of a scan, whether it's a PET CT scan, a regular CT scan, X-rays they approve, no problem. Ultrasounds they approve, no problem. It's 1, 2, 3, willy-nilly. After that, if you need to get other scans, like I said, CT with barium, CT with contrast, PET scan with contrast, all of that needs to be. You have to look at the way the document is worded and what was done prior to that. They tried to say that, well, a CT scan should be good enough. Well, according to what I'm told, the CT scan does show quite a bit, but it's not. It's like taking. How can I, in my mind, the way I'm understanding it is, that's like taking a picture with a Polaroid camera, okay, from the 1980s, as opposed to today in 2025 using a 4K DSLR camera and taking a picture, okay? That's how different the CT and PET scans are, because they wanted from the base of the skull, which is, they told me it was up here. I thought the base of the skull was back here. But anyway, they wanted from here all the way down to halfway down my thigh. So, my boob is showing. You have to put a little bar over here. So, this is what I'm dealing with now, waiting for them to get approval for this other treatment that will help in the healing process of all this chemotherapy treatment. And according to the one document, they'll be sending a nurse over to discontinue this chemotherapy ball on Thursday evening. So it's really not 3 days if you look at it, because they gave it to me around 5 o'clock, 5:30 last night before I left the infusion center. And then today, Wednesday, and they're coming tomorrow at 16:20, I think it is. So they're coming. No. Well, is any vital information on there?
The only thing is the
Yeah, you know what? You could use that out with the scanned image on a computer. I don't know if I'm going to be able to video or photograph any of this. I'll have to talk to the nurse when they get here, or whoever's coming. So it's not really 3 days. It's more like 2.25 days. They did say 3, but because they didn't tell me at my prior visit 2 weeks ago, or a week ago, what time I need to be there. They told me to be there for 11. I was supposed to be there for 10 to do a blood draw and then go see the doctor. And while they're doing they actually do the blood analysis right there. So while you're waiting for the doctor, let's say a half an hour, 25 minutes, whatever amount of time you're waiting for the doctor, they're actually doing all the tests, looking at your blood, what your blood cell count is, white blood cell, your A1C levels. They're doing all of that while you're waiting for the doctor to give you more information, and then go to, and this will be every time I go to get chemo treatments at the center, and I have to be there early to get blood drawn through the port. And it's amazing how simple it was. And it was, if you had to say, well, how painful was it? They actually asked me if I wanted ice. They said most people want to ice it. I'm like, I don't know, I've never done this before. So they gave me an ice pack. Maybe that helped a little bit, but when they put in the tap, which is what I call it, you could actually feel it. It's almost like it's like closing the cap on your dish, on your Dawn soap bottle. You flip the cap, when you push it down, it snaps shut. That's what it felt like. And it's almost like there was like a plastic cap going on top of another plastic receptacle, if you will, underneath the skin. And the pinch was, if you had to put a scale 1 to 10, it was -5. That's how painful it was for me. But then again, well, yeah, I do have a higher pain tolerance because I deal with pain all the time, between arthritis in my back, arthritis in my shoulder. I mean, it comes with getting older. Most people, not everyone's going to get arthritis, but I'm going off a little bit off topic here, but you know, I deal with a lot of pain all the time. And there's been many days where I wake up in the morning, and this is long before I even got diagnosed with this cancer. I would wake up sometimes in the middle of the night or in the morning, and my fingers would be tingly and numb. And a couple of times it was to the point where I couldn't even move my arm. And that's because I get a pinched nerve in the back of my neck. And going to a chiropractor, you can only get 5 visits. I think it's a year that the insurance company will pay for. A chiropractor is not considered medical. That's considered, yeah, there you go, homeopathic. It's supposed to be, how is that homeopathic? That's supposed to help maintain your body, and it does. I mean, talk to the Asian community. They've been doing this stuff for centuries, okay? Right. I was getting, at one point I was doing acupuncture. It did help a little bit with another problem another medical issue that I'm dealing with. But even that, they won't, it's not considered a medical procedure like chemotherapy or getting an operation or just going to see your doctor for your quarterly visits or yearly visits, or how many times you go. I have to go every quarter. I'm supposed to go every quarter because I'm on cholesterol medication as well. They just said, oh, your cholesterol's a little bit high. Okay, whatever. I'm going off track here.
Okay, so I'm going to leave it here for part 2 of 3. Trying to make it so it's easier to digest with 3 parts. So see you in part 3.